My name is Abby Chappell, and the other members of my group are Justina, Katherine, and Tami, and we will be presenting the disease necrotizing fasciitis. The Center for Disease Control defines necrotizing fasciitis as a rare bacterial infection that spreads quickly in the body and can cause death. This disease is a soft tissue infection that has the ability to destroy the tissue in your skin and muscles, along with the subcutaneous layers beneath your skin. The CDC estimates between 9,000 and 12,000 cases of necrotizing fasciitis each year in the United States, with deaths occurring between 1,000 and 1,800 deaths annually. Necrotizing fasciitis can be caused by multiple types of bacterium, but is most commonly caused by the bacterium group A Streptococcus pyogenes, which is a gram-positive flesh-eating bacteria. It is arranged into chains of cocci, is non-motile, and non-spore-forming. Since this bacteria is gram-positive, we know that its cell walls lack an outer membrane but has a thick peptidoglycan layer. Within this bacterium cell wall, there are polysaccharide chains that have acids which aid in maintenance and cell division. This bacteria also has a plasma membrane that consists of a phospholipid bilayer and multiple proteins. This bacteria has a fibronectin or F protein that allows it to adhere to epithelial cells. In doing so, the organism is able to stick very tightly to the cells of the host and enhances its ability to cause infection. This bacteria also contains M proteins, which are important virulence factors for group A by helping strains evade the immune system. These M proteins are heat and acid resistant, which help the bacteria attach to host tissues. This bacteria is surrounded by a hyaluronic acid capsule that is required for the organism to resist phagocytosis, which is a vital key to its survival in host cells. This bacteria is beta hemolytic, which means it produces a toxin that forms a clear zone of hemolysis on blood agar, which demonstrates its ability to destroy red blood cells and white blood cells that are responsible for fighting off bacteria and disease.
My name is Katherine Clark, and I'll be presenting the reservoirs and transmission of necrotizing fasciitis. As far as we know today, humans are the only reservoir of the active and symptomatic disease necrotizing fasciitis. Humans can also carry the bacteria while remaining asymptomatic as long as the bacteria do not reach any blood or inner soft tissue. The bacteria often resides along the epithelial cells of the body, specifically in the regions of the throat, nose, genitalia, and rectum. This being said, there have been rare cases when animals such as cows and chickens have been known to carry the bacterium Streptococcus pyogenes while remaining asymptomatic. These carriers were infected by humans via one of the transmission methods that will be described on the next slide, where we'll also discuss how these carriers then transmit the bacteria back to human hosts. As far as transmission or the spreading of the disease is concerned, people are at the highest risk of being infected when they have any kind of open wound or lesion that allows the bacteria access to blood and soft tissue. The first picture of this slide shows an example of even the smallest open wound that acts as a breeding ground for Streptococcus pyogenes. The most common form of transmission is through direct contact between the bacteria and someone's open wound via respiratory droplets or infected inanimate objects. This form of transmission will cause the disease to become symptomatic and progress in its normal fashion. The other forms of transmission are ways that the bacteria can spread from carrier to carrier until it causes infection. These other forms are dominated by the direct contact with skin that harbors the bacteria, specifically in the regions of the throat, nose, genitalia, and rectum. The secondary of these forms is the direct consumption of respiratory droplets, as can be seen in the second picture on this slide. The third and most rare form of transmission of the asymptomatic bacteria is through eating contaminated food. This is the result of some animals, such as cows and chickens, being carriers of the asymptomatic bacteria. Like I mentioned earlier, humans transmit the bacteria to these animals, which then can transmit the bacteria back to humans. This is done through any of the dietary byproducts of those animals that harbor the bacteria, such as beef, chicken, milk, and eggs. This form of transmission is very rare and has only been observed in a handful of foodborne outbreaks throughout history.
Hello, my name is Justina, and I will be going over the signs and symptoms of necrotizing fasciitis. Early signs and symptoms of necrotizing fasciitis includes high fever, sore throat, stomach ache, nausea, diarrhea, chills, and general body aches. These symptoms and signs are similar to the signs and symptoms of flu and are often mistaken for it. However, at the same time, these patients may have erythema and pain or tenderness around the red area, which is often the infection point. These infection points can result from surgical sites, a cut, a scratch, bruise, boil, sites of medication or drug injection, and etc. I have separated the signs from the symptoms on the slide and the following slides. At the advanced stage, NF patients will continue to have a really high fever above 104 Fahrenheit typically, or they may become hypothermic and dehydrated. The pain in an infected area becomes constant and piercing, much worse than the original injury would be. The infected area may appear bright red, shiny, swollen, and very hot to the touch. As the infection progresses, the affected area will continue to swell, become purple or mottled with blotches of black, purple, and red, and may be accompanied by a rash of blisters, and this is a sign of skin necrosis. There are some pictures in the following slide that will illustrate these signs. The affected area may become indurated due to the infection. Although the pain becomes excruciating over the initial 12 to 48 hours, a very late sign of infection is a sudden improvement in pain or lack of sensation in the infected area. This may be due to the fact that nerves in the area begin to die. The patient may have extreme hypertension and a tachycardia accompanying the infection, which results in dizziness, weakness, and confusion. This is the slide illustrating the different stages of NF as it progresses. At the critical stage, the patient's confusion and weakness worsen, and patient may repeatedly lose consciousness. The infected area will swell to several times of the normal size. On occasion, the swollen area may split open and release large amount of thin, cloudy drainage fluid. Large blisters filled with a bloody or yellowish fluid and blackened necrotic lesions appear, causing the skin to break open. The nerves are destroyed, and therefore the patient may experience improvement of pain to the infected area or lack of sensation. Urine output ceases, blood pressure drops severely, heart rate continues to be rapid and shallow, and patient experiences tachypnea. Eventually, the patient's vital organs such as kidney, liver, lungs, etc. shuts down due to the toxic shock. The skin and other tissues continue to blacken as they die and may shed from the body. Death is imminent. We saw a patient in the ER a couple days ago with NF. Her condition was progressed to a critical stage prior to her being found. She was unconscious, her skin swollen and colored abnormally, and there were foul drainage coming off her wound. She passed away a couple hours later due to septic shock, despite all the medical intervention she was given. NF progresses quickly. Therefore, it was important in the initial and progressive stage for the medical professionals to make the correct diagnosis and give necessary treatment, which will be discussed next.
I'm Tami Charrington, and I will discuss prevention and treatment of necrotizing fasciitis. There is no vaccine that will prevent a person from becoming infected with necrotizing fasciitis. The best way to prevent infection is by using common sense when caring for cuts and wounds and practicing good hygiene by washing your hands regularly. Careful and prompt cleaning of open skin injuries, even minor cuts and insect bites, by washing them with soap and water will reduce the chance of infection. Keeping any wounds covered with clean, dry bandages until they are completely healed. Be sure to receive appropriate care by a doctor for any serious punctures, cuts, or bites, and if you do have any lacerations or open skin wounds, avoid getting in bodies of water like lakes, rivers, oceans, swimming pools, and hot tubs. People who are immunocompromised have a higher risk of infection and a higher risk of death if they are infected. Researchers have found that signs present differently in immunocompromised patients than in those with healthy immune systems. Knowing if you have a higher risk factor could help prevent and quickly treat infection. Some conditions that would hinder the body's immune system are diabetes, cancer, obesity, alcoholism, drug use, smoking, and chronic systemic diseases.
Due to the elevated risk factors and to avoid delays in treatment, doctors caring for high-risk patients may need to be on greater alert for the signs of necrotizing fasciitis. Because necrotizing fasciitis can spread quickly, the best chance for successful treatment is early detection. Prompt, drastic surgical debridement or the removal of damaged tissue is the primary treatment of infected areas. Oftentimes, the subcutaneous area is larger than it appears on the skin surface. Patients have a better chance at recovery when the affected areas are removed early and the removal area is comprehensive. Proper care after skin and tissue removal is crucial to the patient's recovery. Sufficient dressing coverage of exposed bones, tendons, and the remaining tissue prevents the area from drying out and helps the healing process. On average, a patient will undergo 3 to 4 surgeries. Amputation may be necessary to combat rapid spread throughout the body. It takes more than surgery to return a patient to health. Antibiotics are intravenously injected and should be administered at the first sign of infection. Because there are varying types of infection that can be gram-positive, gram-negative, or anaerobic, a broad spectrum of antibiotic therapies should be administered initially. Once the results from microbial cultures are reported, antibiotics can be changed to more directly target the specific type of necrotizing fasciitis you're dealing with. Some of the different kinds of antibiotics used to combat the different types of infections are vancomycin, an intravenous antibiotic that interferes with the crucial cell walls of bacteria, penicillin G, which is a natural penicillin that targets gram-positive bacteria, clindamycin, an antibiotic that prevents bacteria from producing the protein they need to reproduce, and gentamicin, an antibiotic that affects gram-negative and anaerobic infection types. There are some studies that show the use of hyperbaric oxygen chambers can inhibit infection. These are high-pressure chambers that allow you to increase oxygen to the infection site to aid your body in fighting bacteria and to promote healing. Studies have also been done that tested the injection of immunoglobulin antibodies to help reduce damage caused by bacteria. Both of these therapies are controversial and unproven and should only be administered to the critically ill.
NF is known for its fast progress. Although the size of the bacteria, GAS, is only 0.5 to 2 micrometers in diameter, the erythematous area around the infection site can spread quickly, sometimes with a rate of 2.54 centimeters per hour. The NF got its name in the United States during the Civil War. The surgeon Joseph Jones reported 2,642 cases of hospital gangrene with a mortality rate of 46%. And this marks the end of our presentation. Thank you for watching. These are all the references that we use. Thank you.